Daughters of Charity of St. Vincent De Paul, a hospital in Kubwa, FCT, has organized free breast and cervical cancer screening for over 150 Abuja residents as part of its charity work. Dr. Patrick Ezie, head of clinical services, speaks on the services provided.
This intervention was developed by the facility and the St. Vincent Hospital because we began to realize that we're having a lot of women in the community presenting with cancers, breast cancers, and sometimes they die of it because of the lack of awareness. So the hospital decided to look into its corporate social responsibility and see what it can do for the community of Kubwa by ensuring that they have the knowledge that they need to have about these illnesses. So we decided to write to the churches, to the Christian women groups in churches, the Anglican churches, Presbyterian, the Catholic churches, and all the other churches in the area, as well as the market women and the mosques. So we invited them to the hospital so that they can benefit from the knowledge of experts, and so that they can be able to also know that if they can prevent these illnesses from actually taking their lives. Statistically, government has its statistics, but what we were noticing on a facility level was that every 2 months you will hear of a woman that dies of cancer, or a woman presents in advanced stage of cancer in the hospital. Or during routine checks, you see a lot of women coming with cancers and they didn't even know that they had those issues. So it was becoming, from our records, we started noticing that increase, and we're like, no, we need to put this knowledge out there, or bring these women where we can give them the knowledge so that they can begin to take care of themselves.
He urged other health facilities to organize free cancer screening to reduce the rising cases of the disease in the country.
This is a novel project. This is the first of its kind. I think that if other hospitals are doing such projects across the country, it will help women have more information. And I know we live in a very troublesome era where things are expensive and people, the finance is not always there, but health care information is not an expensive thing to provide.
Dr. Ochemwogu, a consultant dermatologist, National Cancer Control Program, Federal Ministry of Health, said the government was making efforts to create more awareness about the disease.
What needs to be done is actually awareness. So when people are aware of the disease and the risk factors and they prevent it, so until we remove those risk factors, we will not start having new cases. So that is why government is making effort to introduce the vaccination for the cervical cancer. So until that vaccine is there, we won't be able to say you are going to remove the new cases. And then for breasts, as long as the genetic predisposition is there and other environmental risk factors are there, you will keep having new cases. But what government is trying to do is create enough awareness, let people know about the risk factors, and once they are reduced, then the number of new cases will also drastically reduce. And then when you have screening facilities, treatment facilities across the country, then there will be early detection, and then people will no longer have the late presentations, which is what we see currently in the country. So once we start having those late presentations, then we will start having better outcomes, and people can actually survive breast cancer for a long time.
Ms. Rukaya Abdulrahman, a beneficiary of the screening, appreciated the hospital for the gesture.
I advise every woman to screen regularly, to take advantage of all these opportunities to get screened, because as is popularly said, prevention is better than cure. The money you spend treating can never be compared to the regular diagnosis.